difficulties this afternoon, but I think it says we're live now, so I'm excited to welcome you all in here for this important conversation. Welcome and thank you for joining us for Hot Days, High Stakes, Protecting Maternal Health in Extreme Heat. This is the second webinar in our three-part summer series focused on extreme heat here. The series is brought to you by Moms Clean Air Force in partnership with the Nicholas Institute for Energy, Environment, and Sustainability at Duke University. Moms is a community of 1.6 million moms, dads, and caregivers united by our mission to protect children from air pollution and climate change. We envision a safe, stable, and equitable future where all children breathe clean air, and we work throughout the country to protect children's health. Maternal health is also a core focus for Moms Clean Air Force and for Eco Madres, our Latino engagement program. We push for the strongest possible federal standards across all sectors to reduce harmful air and climate pollution, supporting mental health, supporting maternal and infant health, and we help educate our members on how they can protect their bodies during the vulnerable windows of pregnancy through a wide range of bilingual content and platforms. My name is Maria Finnegan, and I'm a national field manager with Moms based in New Hampshire. I work with organizers across the country who are leading critical advocacy efforts at both the local and federal levels. I'm also the mother of a 4-year-old boy who made this fabulous necklace which I'm wearing today. It's now my privilege to share a bit about our incredible speaker, Dr. Ashley Ward. Ashley Ward, PhD, is the director of the Heat Policy Innovation Hub at Duke University's Nicholas Institute for Energy, Environment, and Sustainability. Her work centers on protecting human health and enhancing community resilience in the face of climate threats, especially extreme heat. Ashley brings together scientists, policymakers, and local leaders to develop effective, community-informed solutions that reduce the risks of heat exposure. Prior to launching the Heat Policy Innovation Hub, Ashley played a key role on Duke's Internet of Water Coalition, where she led stakeholder engagement and helped public agencies modernize their water data systems. She also spent years working with NOAA's Carolina Regional Integrated Sciences and Assessment Team, where she connected rural and urban communities to climate and health data, especially related to risk, resilience, and decision-making. Ashley holds a PhD in geography and has worked directly with North Carolina communities on a range of issues, from food access to climate adaptation. Her passion lies in bridging the gap between data and action, translating complex science into real-world policy solutions that meet communities where they are. Ashley and I had the great pleasure of speaking for our last webinar, so I'm so excited to have her back today to learn about a whole different group of people who need to be really aware of how heat impacts their health as they're expecting.
Thanks so much for having me.
Is that working?
I'm not sure how to advance my slides, Maria, sorry. I can get going just talking about a few things, but also not quite sure how to.
We'll control the slides for you.
Okay, that sounds great. Thank you. So yeah, it's great to be here with everybody to talk about this issue. This is a little bit of a passion project for me. I myself entered into preterm birth, my oldest child, from heat exposure. So it really is a personal story. Next slide, please. It seems like every year, year after year, we see some of the same tragic stories. One like last year, of a family celebrating, July 4th at the lake. It was a brutal heat wave in Arizona. Temperatures soared to nearly 120 degrees, and a 4-month-old little girl was on a boat trip with her family, just trying to enjoy a summer day. But her little body couldn't handle the heat. And at some point, the baby lost consciousness. Despite the family's best efforts, she tragically died from environmental heat exposure. And this included hemorrhagic shock, brain injury from lack of oxygen, and severe dehydration. All of these things triggered by extreme temperatures. As with most of the cases that you see on the screen and elsewhere in the country that we read about, these aren't cases of neglect. They are a stark reminder of how vulnerable pregnant women and their babies are to extreme heat and how quickly tragedies can happen. These heartbreaking cases remind us that heat isn't just an inconvenience. It can be lethal, even for and especially for the youngest among us and their pregnant mothers. Next slide, please. The World Health Organization has called heat a neglected and underappreciated threat to maternal and infant health. And this isn't just happening in faraway places. Next slide. Here in the US, CBS News reported this spring that climate change has nearly doubled the number of pregnancy heat risk days over the last 2 decades. In North Carolina, where I live, we've added 13 extra heat risk days each year for pregnant women. So it's not just about discomfort, it's about rising health risks for pregnant people and babies in our communities. Next slide. One thing to keep in mind, and this is generally, this is not just for pregnant women, right, and infants. This graph that you see here, I hate I don't have my pointer that you could see, but if you look on the right-hand side, you see average daily emergency department visits in North Carolina. And you see that peak is actually not at temperatures above 100 degrees. It's actually occurring in the low to mid 90s. This data shows that we see more people getting sick on what is called abnormally hot days, which are between 90 and 100 degrees, not necessarily exceptionally hot days, days that are more than 100 degrees. Now, this is likely because temperatures in the mid 90s are easy to ignore, especially in places that are historically hot. But it also is a reminder that we may be vulnerable long before we ever really appreciate how vulnerable we are. And this is especially the case for vulnerable populations, of which pregnant women and their infants are included. Next slide. I think I've lost my slides.
Sorry about that, Ashley.
That's okay.
Everyone, we've just been having crazy technical difficulties today in a way that none of us had expected. But, you know, one thing we can do while we're waiting on that, if you are comfortable with answering a few questions, I have a few that I thought of that might be possible for this time.
Sure.
If we get back up. Awesome. Okay.
I can try and share my screen directly if you like me to.
Sure, if that works.
Let's see what happens.
Yeah. Okay. Well, that's all right. We'll get it. We'll see if we can get it figured out. But in the meantime, I'm so glad you brought up some of those recent current event stories, because it seems like every summer there's always some incident where, you know, at no fault of the parents, a child or infant is put in extreme heat conditions and unfortunately isn't able to make it. So I always, as we enter this time of the year, I think about these impacts. And looking at the news that we've had in the last week or two, it's really been on my mind, understanding how extreme weather events can impact, you know, all communities, but especially women and people who are expecting. So the question I had is, as we see an increase in extreme weather, disruption of care is a real threat to all populations when there is an extreme weather event or a brownout or a power failure. Are there any steps that pregnant people or communities can take to prepare for some of these situations?
Yeah, and that's a really good question. I mean, I think, in fact, some of the things that we see, we do see increasing. Oh, it looks we might be back in business, Maria. I can go ahead and answer that question, though. I
Yeah.
think the point to the question really is preparation is key. So we know when dangerously high heat is forecasted, right? So when you know that that's coming, and I would say, keep in mind the graph that I just showed. It doesn't necessarily have to be above 100 degrees to be dangerous, right?
Mhm.
Um, and so one of the things that you can do to prepare is to prepare ahead of time, which means reach out to public health and emergency management and find out where cooling centers open in your community,
Mhm.
and what thresholds they open. But
Mhm.
also think about what are sort of called informal cooling centers. Where can you go? Your church, community centers, a Walmart, a mall. Where can you go to get out of the heat for a few hours? Think about also making plans ahead of time with family, friends, or neighbors that live nearby. Make sure that you understand if you're on certain medications, or let's just say you have gestational diabetes or something like this, that you're having conversations with your doctor's office about the vulnerability that you have, especially if you're relying upon things like refrigerated medications. Those things are really challenging when we lose power. Um, but community networks matter. Who is checking on who in our neighborhood and among our social groups? It's so important. And in fact, we see over and over again in studies that those networks are more protective than almost anything else we can do with respect to almost any kind of disaster. And so, really thinking about who in your network, and building one in your neighborhood if it doesn't exist. Who's calling and checking on the elderly, pregnant, so vulnerable populations in your community. Advocate for things like local emergency planning that prioritizes outreach. If you're leaving a rural area, for example, a lot of this happens through the volunteer fire departments and things like that. Don't forget those folks, because they really play an important role in reaching out to people. Now, if you have to stay at home, and I'm going to share later in the presentation things that you can do, but creating a cool space in your home using a variety of different methods is really important, so that you're prepared at home too, so that you make sure that you have everything you need before anything happens. So preparation is really key. So I'm happy to get back to the presentation
Yeah,
if
let's
you
do it.
okay, so next slide, please. Okay, so this might be hard for folks to read, and hopefully they'll send out the slides later, but this is a framework that the WHO has put together, and I actually really like it. It seems complicated, but it's not. It provides a helpful framework for us to understand and think about how heat impacts pregnant mothers and their babies. So, sort of all the way over on the left-hand side of this graphic, you have pregnant people and their babies are exposed to heat. And sometimes this is at work. Sometimes it's at home through inadequate cooling. Maybe you can't afford it or don't have access to air conditioning. Maybe you live in an area that's traditionally been cool, and so you don't have air conditioning at all in your house. Or you're just outside during one of those heat days that I just talked about. So that exposure then interacts with different biological vulnerabilities. Pregnancy places an extra strain on the heart and the blood vessels. And babies are born without the ability really to sweat or regulate their temperature effectively. So you get the combination of exposure and then biological vulnerabilities. And then you add on top of that social factors like inadequate housing or a high exposure job or lack of access to care. And so maybe your underlying conditions aren't well managed, like asthma or diabetes. And then consider that our healthcare systems typically aren't designed to screen for heat vulnerability in prenatal care or newborn check-ins. So they're not often asking pregnant women, do you have air conditioning? Are you able to afford air conditioning? So all of this sort of combines to raise the risk of preterm birth, low birth weight, stillbirth, all kinds of dangerous heat illness in newborns. And want to also point out, my own research is focused on preterm birth, but heat exposure has been linked to all kinds of other conditions. It increases inflammation. It places cardiovascular strain on the pregnant body. It disrupts the balance of hormones that are critical for sustaining pregnancy. So these risks are not theoretical or imaginary. They're showing up in emergency rooms and labor and delivery units, and we track these. Next slide, please. I want to dive into a particular outcome based on the research that we've done here in North Carolina, and that is on preterm birth and heat. This comes out of our engagement with communities throughout the state. When I was working with NOAA, when we were entering into communities in North and South Carolina and talking to them about who do you think is vulnerable in your community, we were thinking the typical, right? Those who work outside, those who are aged, maybe children, but pregnant women kept coming up. And this was over 10 years ago, so it wasn't as commonly talked about as it is now. And so finally our team, I said, okay, look, everybody keeps bringing up pregnant women as a vulnerable group. Maybe we should check on this. And I was really shocked to find out that there had not yet been a study conducted in the southeastern US, and hardly any in the US period, that looked at the impact of heat on preterm birth. So that's what we set out to do. And this study was published in 2019, the first one for the Southeast, which still blows my mind. What we found were increased temperatures, particularly overnight temperatures, increased the risk of preterm birth, and quite substantively. Now, typically when we think of preterm birth, we think of people who are at risk based on these criteria that you see on the screen. Somebody who's had preterm birth in the past, somebody who's giving birth to multiple twins or triplets or so on and so forth, somebody who smokes, uses alcohol or drugs, someone who has little or no access to prenatal care or has some of these underlying conditions. Next slide, please. And typically studies that looked at the impact of heat on pregnant women, they would look at, say, a heat wave happened and let's see what happened. Or the studies would look at how does cold and hot affect women. There were very few studies generally, mostly concentrated in the Western US. There was one, I think, in Boston, but most of them were overseas. And what these studies found was that heat waves were in fact associated with preterm birth, but how much that association was dependent upon the strength and the length of the heat wave exposure. It also showed about a 1 to 2% increase in risk for each degree interval. And this is a really important thing. I want you to put that in the back of your mind and remember in just a moment. And it showed a high correlation with heat index, which is the combination of air temperature and humidity. Next slide. But what we wanted to do is not look at single heat wave events. We wanted to look at chronic heat exposure, everyday heat exposure. And we did that and looked at multiple different heat exposure metrics, maximum air temperature, minimum or overnight temperatures, mean or average temperatures, the heat index, lag. So did people get sick, 1 to 5 days after they were exposed? What about cumulative heat over 3 days? What about departures from normal? How unusual was this temperature for the place in which you are? And we also wanted to then say, okay, so not only do we want to look at sort of chronic heat exposure and its impact on preterm birth, but we also wanted to look at where do we see thresholds where women are actually experiencing preterm birth. That could help us maybe think about how we structure our warning systems or let physicians know when to warn their patients. Next slide. I said study. I'm sorry. Okay, so this is one of the things we found, and the biggest correlation between preterm birth and heat was actually in overnight temperatures, not those maximum daytime temperatures, even heat index. It was overnight temperatures. So when temperatures failed to drop below a certain degree overnight, we saw the risk of preterm birth increase. I don't have my pointer, but I want you to pay attention to the last category there where it says Eastern. The green arrow says minimum temperature, 75. So at 75 degree minimum temperature, meaning when the temperature does not drop below 75 degrees overnight, if you go over to the next column, you see it's 1.04. That means there's a 4% increase in risk of preterm birth. And that 75 degree temperature overnight falls in about the 90th or 92nd percentile of all overnight temperatures for this region. Now, a couple of things I want to point out in this study. Look at how the increase in preterm birth risk increases as those temperatures increase. By the time you get to 80 degrees overnight, you're at a 7% increase in risk for preterm birth. That's actually starting to add up to be quite significant. Also wanted to point out, I've circled in red the percentile. Now, typically, our National Weather Service issues warnings when respective temperature thresholds meet sort of the 95th or sometimes the 98th percentile. But what you see in this study, and this has been followed up in many studies afterwards, is that we're seeing actual health outcomes occur at the 88th and 90th percentile. This means that women are affected by heat, pregnant women are affected by heat long before they would ever receive any kind of warning through our currently existing heat alert systems. This is a very important point. It means that people are vulnerable maybe when they don't even understand they're vulnerable yet. Next slide. So our key findings from our work, and again, we've seen these replicated in studies all over the country, was that pregnant women are vulnerable specifically at overnight temperatures, and they're vulnerable at levels much lower than our current warning systems let us know. We also found that pregnant women that lived in rural areas had higher vulnerability to heat than pregnant women that lived in urban areas, surprisingly so. But ultimately, we need to do a little bit better job at understanding what's happening here. Is this based on occupational exposure during the day, the inability to be able to afford air conditioning, inefficient housing? We had studies last summer that came out that showed that extreme heat raises the risk of hypertension, gestational diabetes, and pregnancy complications that increase the risk of hospitalization as well. I think, cumulatively, what these findings show us is that heat is quietly placing an enormous strain on our pregnant bodies. And though these findings are helpful, we need to do a little bit more research to understand better the mechanism of these relationships and why pregnant women, sort of the social factors in that WHO chart, if you will. Next slide, please. This isn't getting any better. This is I just pulled weather station data from Fayetteville, North Carolina, which is in eastern North Carolina. This is 75 years of overnight temperatures. And what you can see all the way to the right-hand side, and this stopped in 2017, was that we were already at almost 30 days of temperatures hitting 75 degrees or higher. In fact, we've exceeded 30 days since that point. So overnight temperatures are not getting any better. And in fact, they're persistently getting worse. Next slide, please. And so overnight temperatures generally, I want to call your attention to this chart on your right-hand side of your screen. These are predictions for global averages at the 2 degrees Celsius mark, which is where we're expected to hit for global climate change. And this is from the IPCC report. At the top, you see the average change in daytime temperatures, and certainly those are considerable. But I want to focus your attention on the graph, the map at the bottom, which is where you see nighttime temperatures. This is really substantive. Look at many parts of the United States where we're looking at a 10 degrees or more change in nighttime temperature. That is really staggering with the results of the studies that I was just telling you about. And certainly this is an issue for pregnant women. Why is this? For one, when overnight temperatures remain persistently high, it means that we have inadequate physiological recovery. It's hard for our bodies to recover from anything that we were exposed to during the day when temperatures remain high overnight. Next slide. It also means that our cardiovascular and respiratory strain on our systems increases. And this is particularly dangerous for pregnant women whose cardiovascular systems are already working a little bit overtime. Next slide. It causes quite a bit of sleep disruption and cognitive impairment. Overnight temperatures are linked to all kinds of things, but particularly like increase in accidents and all kinds of things. So sleep disruption is very important for our overall well-being, and particularly for pregnant women. Overnight temperatures increase our mortality, meaning when overnight temperatures remain high, it means more people die, not just get sick from heat. Next slide. It compounds the risk for other kinds of vulnerable populations, pregnant women being one of them, but also aged populations and those who were taking certain prescription medications. It reduces our productivity during the day. So if you're a pregnant woman that's working, and many pregnant women do, it makes it harder for you to maintain that level of productivity during the day. All of these things mean we pay more money in healthcare costs as we're trying to manage these these assaults on our health and well-being. And it means that the cost of our households is higher because we're paying more money for to cool our houses when it doesn't cool off overnight. And this is particularly a challenge for pregnant women. It means that the housing market is much more difficult. When we get a higher housing cost, it means people are having to pay lower rent, which means they're usually in lower quality housing. And of course, for our children, it can cause quite a bit of educational disruption. We know that there are already studies that show the link between educational outcomes and temperatures, particularly overnight temperatures too. Thank you. So this map is something to show you. This is just from the last couple of years, right? So this map is showing the number of days per year where nighttime temperatures exceed 75. Now, I want to point out, of course, in the Sun Belt regions of the country, you see, even 30 to 60 and over 60 days a year where women are at this higher risk. Just because those areas in the Northeast and the Midwest and the Northern Great Plains are not experiencing overnight temperatures greater than 75 doesn't mean they're not experiencing extraordinary overnight temperatures. We see impacts. It's reasonable to assume in these areas that haven't historically been hot that we might see impacts occurring at a much lower temperature threshold, say 7 degrees or above. So it's important to pay attention to when overnight temperatures are just abnormally hot for your region. Next slide, please. We did another study that looked at when can you use a fan to adequately and safely cool your house. And what we found is we are already hitting many hours per year where we are exceeding safe fan use. And so what this study showed is that in some places, certainly those that you see are very dark red, we're hitting daytime temperatures where it would be impossible to get your household to a cool enough state using just a fan. In other words, you must have air conditioning. Now, the threshold that we set in this study was 37 degrees Celsius or 98 degrees Fahrenheit. The challenge since is that we have seen more and more evidence come out that actually 35 degrees or Celsius or 95 degrees Fahrenheit is actually the threshold. So you can imagine how this map might change, even updating this study from a couple of years ago. So this is important because if you think about it, we're talking about can people, and pregnant women are some of the most vulnerable people. They live in public housing, for example, where we don't have cooling standards that require air conditioning in public housing. Pregnant women also tend to live in low-income housing, also where they might not have adequate access to cooling. And so when we look at maps like this and we think about areas of the country in which we must have air conditioning in order to maintain a safe indoor environment, what we're seeing increasingly is in those communities that do have, say, lower income communities are exactly the communities in which we're seeing exceeding these thresholds. One way to think about this is if you're a community group and you want to then maybe target your resources for, purchasing air conditioning, for example, or helping people pay for air conditioning. Maybe using information like this helps us target where those investments can be made to the communities that are already exceeding those safe indoor thresholds. Next slide, please. So scientists have been very busy, physiologists around the world, and one of my favorite is Ollie J, who runs the Heat Health Incubator at the University of Sydney in Australia. His team has done, I just think some of the best work in the world on thinking about what do you do if you don't have air conditioning? How do you cool yourself off? You can get access to this information at our website too, and these are downloadable for you to use for free. And so what you see on these next couple of slides are what you can maybe do. Electric fans, but what I love about his work is he shows when we're starting to hit the threshold for safe fan use. Basically, when it gets too hot, you're just pushing warm air around. You're not actually cooling yourself off anymore. Self-dousing, which is when you wet yourself, your clothes. That sounded bad. I didn't mean it that way. Meaning you wet your clothes or you spray yourself with a mist to kind of cool yourself down. Foot immersion. This is really awesome for pregnant women. So there's quite a lot of research that shows that when you immerse your feet in cool water over your ankles, you can actually lower your core body temperature. And this is a really great thing for pregnant women to do, is when you come home, maybe from your work day, think about taking a cool shower. And if you can't take a cool shower, think about soaking your feet in some cool water. It really helps. Wet clothing, that's when you like take your shirt and you dump it in cool water and you put it back on your body. So if you're outside and you're working, this is a great way. You need to do that about every hour, though, for it to be effective. Next slide. I'm going to come back to evaporative coolers in a minute. Misting fans. Ice towels, and I'm going to talk in a moment about how to place ice towels, but certainly getting towels and put them in a cooler when you're out and about so that you have a cold, wet towel to use to help you cool off. One thing to note, though, cold water ingestion. A lot of people say, make sure you drink and stay hydrated. That is true. You absolutely should drink and stay hydrated. And if you're a pregnant woman, you should drink extra during heat season and stay hydrated. However, please keep in mind that drinking cold water alone is not enough to lower your core body temperature. You need to do these other practices or get yourself into air conditioning to do so. A note about misting fans and evaporative coolers. These work really great in dry, low humidity environments. A lot of people might say, oh, I use a swamp cooler or an evaporative cooler. If you're in the high humid Southeast, for example, you may get into a situation where you just increase the humidity in your house and actually make it even harder for your body to cool down. So please be careful about the use of evaporative coolers and misting fans. Instead of misting fans, maybe you can get out of the shower, take a cool rag and sit in front of a regular fan, making sure the water is actually on your body and not in the air. That's just adding to humidity. Next slide, please. So here are some resources that the U.S. military has put together. If you can't soak your feet, I like to use these. These are great for all kinds of practices. You can also soak your arms over your elbows, and you see in the illustration there below. So this is something you can come inside or dip your arms in a sink full of cool water. If you work in an environment where it's very hot, you can think about filling a cooler with cold water and using it to dip your arms in. You should do this again as frequently as you can. There's a chart at the top of that infographic that tells you how long you soak in water at certain degrees. Ice sheet cooling, I want to note here the placement of the sheets. So you have the sheet that you can lay on, which is very effective. So you take literally a sheet and you dunk it in a cooler of water and lay it down and lay on top of it. But if you only have towels, notice the strategic placement of those towels in this infographic, meaning you want to put them where your body is pumping blood. So the blood is coming to the surface of your skin. You want to cool it off so that it cools off your internal body temperature. So that means you want to put it around your neck, under your armpits, and in your groin. I see a lot of people put cold towels on their head. That is not as effective as putting it around your neck and your armpits and groin. Next slide. So what about infants? Newborns are even more vulnerable than we might think. Their small little bodies heat up faster. They can't cool themselves through sweating or by voluntarily seeking shade. During heat waves, hospitals see spikes in infant dehydration, heat exhaustion, and respiratory distress. And there is emerging evidence that extreme heat may be linked with higher rates of sudden infant death syndrome or SIDS, though I think more research is probably needed to make that correlation. So how does this affect infants? So babies have a higher body mass to surface area ratio, meaning their body temperature rises more quickly than adults in the same hot environment. They also have less developed sweat glands, so it makes it harder for them to cool down. Overheating in infants can lead to heat stroke, like the story I told at the top of this, a very dangerous condition where the body temperature rises to critical levels, which can cause organ damage. In babies, heat stroke looks like red, hot, dry skin, nausea, vomiting, weak pulse, listlessness, dehydration. Newborns lose fluids more rapidly than adults. This makes them very susceptible to dehydration. Dehydration then exacerbates the effects of overheating and contributes to heat-related illness rates in infants. And signs of dehydration for infants are things like fewer wet diapers, again, dry skin, and lethargy. Then you have heat rashes, known as prickly heat, in some cases a common skin irritation that's caused by blocked skin ducts, sweat ducts that appears. It's pretty uncomfortable for babies. It's little red bumps on the skin, usually where clothing rubs against the skin. So especially babies that are premature or born with other kinds of health conditions are even greater at risk. And so it's really important that we make sure that we're paying very close attention to our infants when we're out and about. Keeping babies out of the sun during the hottest part of the day, which is like 10 a.m. to 4 p.m. And when they're outside, dress them in lightweight, breathable clothing. Sometimes I see people really overdress their infants outside. Be very careful with this. It can be long sleeves, but really lightweight. Ensure that babies stay hydrated. Offer them extra breast milk or formula or water if they're older babies. Use fans to circulate air around the baby. There are all kinds of fans that can clip to strollers, but maybe try not to just direct it right at the baby. You want the air to be flowing around them. And check on them frequently to monitor for signs of overheating or dehydration. Use a cool, damp cloth to wipe down their skin, helps them cool down, especially when air is circulating. And never, of course, leave babies unattended, even a short period of time in a car or anywhere else. During heat season. Next slide, please. So my colleague that I was talking about, Ollie J, did a great study. I love this study. I see people do this all the time in the summer, and it's so dangerous. He's done phenomenal work helping us understand how we can protect ourselves against the heat. And they put together this great infographic that I find super helpful. I often see people in the summer put blankets over the opening of their baby carriage. This is very dangerous. And, if done incorrectly, it can really put your baby seriously at risk. So covering strollers with a dry cloth can actually worsen overheating. It can mean that inside the stroller increases by like 7 degrees in just 20 minutes. So it happen really fast, and it's pretty dangerous. It creates kind of a greenhouse effect where solar radiation comes through the cloth and heats up the inside, but air can't circulate. So a safer approach is to use something like muslin, that really lightweight fabric that is wet. Wet it with cool water, and then you can drape it. That alone, a wet muslin drape with a fan clipped on the stroller, can reduce the internal temperature inside the stroller of up to like 9 degrees Fahrenheit. That's huge. The damp fabric promotes kind of evaporative cooling while the fan enhances the airflow. So together they can reduce the temperature inside. So you want to saturate the cloth, but then wring it out really well to keep it no dripping. You can also pre-moisten it a little bit with a spray bottle. I also want to, again, just like evaporative coolers, point out that when it's very, very humid, you don't want to necessarily introduce more moist air. So an alternative is to clip an umbrella on the top of the stroller, so you're providing shade, and also the fan. So you have shade and then the air blowing. These things often work very well at helping keep your baby cool in their stroller. Next slide, please. So what can you do? Keep talking. Raising awareness about is one of the most important things that we can do. And it's a great way that civil society can play a role in helping protect pregnant women and their children. We do need more training of healthcare providers. We also need to create, though, community knowledge about these things. We have all kinds of things that we know about. If I said stop, drop, and roll right here, we know this because we've socialized what to do if you accidentally get caught on fire, for example. We need to do those kinds of campaigns for heat, and particularly for pregnant women and children, to better understand their risk and also help them understand what they can do to mitigate that risk. It's also important to know the warning signs: dizziness, preterm contractions, irritability in infants, all of those things that I pointed out earlier. Take heat alerts seriously. They're issued to protect your health. And so when you see someone in distress in your community, know what to do. First, get them to air conditioning if you can, but most of the time that's not available. Second, think about how you can use water effectively outside the body, including inside the body. Think about where to place those cool towels on your neck, armpits, and groins. Can you get their feet or arms into cool water? How can you help their body cool down? Get in the shade, put them in front of some wind flow. These are the things you want to have in the top of mind so that whenever you see someone struggling, you know what to do. Acting fast is really critical. If you don't see someone cool down in 15 or 30 minutes, it's time to get them some medical help, right? And especially if you see signs of heat stroke. Signs of heat stroke include vomiting, loss of consciousness, if someone seems confused. Those are not moments where you think, oh, I'm going to see if I can wait this out and cool down myself. Those are moments in which you call 911 and you get help immediately. Thank you so much. I know that, Maria, you have some additional questions, and I'm happy to answer them. And please don't hesitate to visit our website. We have all kinds of resources on the website that help you understand how best you can protect you and your family and your community.
Thank you, Ashley. I spent most of the presentation just thinking about my own pregnancy, and thinking about how I wished I had had so much this information. I was fortunate that I was in the Northeast, and that was maybe more of a cooler summer. But I do remember the effects of and feeling the effects of the heat, especially as I got into like the 8th or 9th month. Where, from what I understand, as the baby gets bigger, your lung capacity shrinks, right? And I remember feeling short of breath, and since coming on to moms, I've started to understand really how heat impacts air pollution and vice versa, and how heat can trap poor air quality, and how that would just be so much worse for somebody who is carrying a child and has that reduced lung capacity.
Oh, yes. There definitely are studies that show relationships between poor air quality and preterm birth and other maternal health outcomes. I mean, that's certainly a thing. And I think, one of the challenges is I really do feel like there are so many people who just are unaware of the risks that they're in. And so I think part of it is just normalizing this conversation among our women friends and, in our neighborhoods and our community groups and organizations, but also, as health providers need to be thinking more about who's sitting in front of them at their prenatal care checkup visit, and who's helping, are they giving information to them about specifically how they're at risk. Someone asked if the resources are in Spanish. We do have one of our resources available in Spanish that gives, it's on our website in English and Spanish. We're working on the others as well, but it's already available in social media ready format. So you can download those and use them for Instagram and Facebook in both English and Spanish. It tells you this, the different levels of, heat exhaustion, heat stroke, the symptoms, and what things that you can do to mitigate those. So please, and I'll put our website, I can put our website in the chat or share it, with all of you, but those are free for people to use. CDC also has resources, and the National Integrated Heat Health Information System, NIHIS, with NOAA also has resources.
Yeah, that was another thing I was thinking about, was how reflecting on all the things I was told as I was pregnant, and I don't think heat was really mentioned once in terms of those impacts and what it could do. And also, recognizing that physicians probably need to bring this into their conversations, but also when you are expecting, that it's really on yourself to think about all of these things, and obviously the first element of that is getting the education, understanding. So it really is, both a personal and community-wide responsibility as temperatures continue to change to keep an eye out for one another. And I recognize, being in a more rural area where I am, sometimes it's harder to have that person checking in on you or watching out for you.
Yeah, and there are all kinds of services that I think about. I mentioned volunteer fire departments, but there's all kinds of services in rural communities, that churches are engaged very heavily in rural communities, and also civic organizations like Ruatan clubs and others. And they often do things like, Meals on Wheels or deliver meals to people. And those are great opportunities also to say, how are you staying cool, or how are you doing? Are you able to run your air conditioning? And, so thinking about integrating heat awareness into just everything we do is one way to really normalize the conversation.
Well, the moms team has been busy this week. Our heads are kind of spinning as we've been testifying in front of the EPA and for a number of potential rollbacks that will, not only impact children but also maternal health and mothers and things like that. And one of the scary ones we haven't been testifying about yet, but that is being threatened, is the rollback of the endangerment finding. And recognizing that is kind of the basis for all of the regulations that we've been able to enjoy over the past decade and a half. Without getting into too technical or places that we wouldn't necessarily want to discuss, I'm curious what you think, if these things do get rolled back, if we continue on this pace or even faster, what that could really mean for children's health, maternal health. Like, what are we looking at as an expert?
Well, I think, across the country, people are starting to have this dialogue about how the landscape is shifting away from being led by sort of federal regulation, regulatory environment, and also investment from the federal government, in these programs and these grants. What that means is that there's going to be more burden placed on state and local governments in order to pick up what's not happening at the federal level. Now, state and local governments, many of them are thinking about this too. I mean, they're absolutely aware of what's happening, and they're also trying to figure out how they're going to fill the gap, right? And this is where we can think about things like philanthropy and the private sector and the role that, this is going to be one of those moments where it is yes and all of us together, everybody that makes up a community, which includes the private sector businesses that are in that community. It includes the NGOs and civil society that operate in that community. It includes philanthropic organizations that operate there, churches and other kinds of faith-based organizations, in addition to our local and state governments. And so I think, that we're going to see, hopefully these groups of people start to come together for real multi-sector collaboration. That is my hope. I also want to point out that a lot of these organizations are already doing a lot of good work. Many of them are concerned about what's happening with the shift in funding and also the shift in oversight and regulation and what that might mean. And so now's time to also advocate to your state and local government about how they can maybe pick up some of these responsibilities that have been in the purview of the federal government. And so, I mean, there seems to be a shift happening. That where power is moving from the federal state to the state and local governments. And, some states are being very proactive, right? And thinking about how they can manage this.
Thank you. Yeah, I mean, it's been interesting as I've been listening along. It's really a time for more community engagement and coming together and being responsible for one another. And, as many people may have experienced, in kind of a tricky couple of months for us as we see the landscape change. We've done so much work at the federal level, and we're shifting to more work at the local and state level. But it's also one that brings us a lot of opportunity, right, to engage with these nonprofits and churches and other organizations that are doing this work, and tapping in and maybe being surprised at how we can reach more people this way and find new ways to come together to solve these problems. So, I'm so grateful for your presentation, because sure, it was a lot of heavy stuff, but it was also empowering, right? You present the material, but also talk about ways that, you can protect yourself and how you can protect others in your community. And it's actually interesting. Somebody in the questions asked, looking ahead to our next webinar 3, where we're going to be focusing on heat action plans. And the question is specifically around parents. Should parents be implementing heat action plans? And I'm thinking that when we get to that, in the coming weeks, we'll be able to have a good directive for parents who obviously have many reasons to be concerned about these issues.
I think one thing to keep in mind, I have some friends that work in emergency management, and they remind me all the time, whenever a disaster of any kind happens, look around you. The real first responders are the people that are around you right now, right? The people in your neighborhood, the people at your church, the people at your school, the people in your community. Like, that is actually who's showing up for you first when things happen. They're there long before the Red Cross or FEMA or anybody else gets there. And so, to your point a moment ago, it is absolutely scary for a lot of people right now to think about what's happening with the changes and investments from the federal government. But at the same time, we have a real opportunity to build incredibly strong communities, incredibly resilient communities, and build relationships with one another that perhaps we've lost. And so I think, when we think about preparedness, adaptation, and resilience and preparedness for things, taking this moment as an excuse, a good excuse, right, to form community groups that do this kind of work means that you're going to be better off regardless of what's happening at the federal level, always.
I do want to ask this extra one here before we close up, because it's something that we've all been seeing a lot recently. How do you address misinformation or alternative medicine when it comes to extreme heat?
Yeah, that's a really good question. And that's a hard one. I mean, I think people are trying, I would like to think that even people who are giving out misinformation, their intentions are good, right? They think they're giving something that's good information. So, and certainly I get a lot of people that write to me saying, why didn't you say, this is what we do in our family to do this, right? And so what I try and convey to people is what might work for one individual, what might be sort of an anecdotal treatment of something is not something that perhaps we see borne out in the research that shows that it has the impact that we're hoping for. And so I usually, when I'm talking to people, I just stick to what the research and science says and says, that might be a good idea. However, this is what the research shows. And usually that's how I deal with it. Quite frankly, I think that the more good information that we put out there, the more we talk about what is in fact supported by the research, the more we can also drown out the misinformation. We can be just as noisy with good information as people are with bad information.
Thank you. I know it's with so much information these days, it is hard to stay focused on the science, right? Because you're fed different things through social media and things like that. And people who you think are your peers are saying certain things. So it's a great reminder to really focus on, science that is backed by research, backed by findings. But yeah, I mean, we all have those anecdotal stories that our grandmothers told us, that maybe worked X number of years ago. But again, this is a different reality. So trying to keep that in the back of your mind as you're approaching these different things.
Well, please don't hesitate to reach out to us if we can be a further resource. We'd love to.
Yeah, you're awesome. And I'm so grateful, everybody, since this, we had our first webinar. Ashley's been presenting at major conferences and she's been in the New York Times. So we're just really so lucky to have her here with all this, really cutting edge information that really needs to get out to as many places as possible. And as we mentioned, we'll be doing a third webinar. We're still working on the date for that. But thank you all. Coming up on the screen here, you're going to see 2 QR codes, if we can figure this out. The first one is a link to sign up for the third session. We're working on a heat action plan with Ashley, which is going to be awesome because I would really like one in my little town. And the second QR code is a way to take action today. What's one of the most amazing things about moms is that since there are a lot of moms on the team, we don't always have a lot of time, but we also we feel compelled to take action with these things that are changing and threatening our children's lives. So we have this opportunity to just sign a petition pretty quickly and it's regarding the endangerment findings, which I mentioned before. We're working very hard to protect that. It's the scientific foundation and legal backbone for how the EPA cuts climate pollution. So if we undermine that, we're going to endanger everybody living on this wonderful earth. If you sign this petition today, it's going to be sent to Lee Zeldin, who unfortunately is threatening a lot of these great regulations we have in place protecting families across the country and the world. So if you will take the time, it's so quick and easy just to scan the code and sign that and send it off. And that will be your great action for today. If you're not already signed up to receive our newsletters, our quick petitions, please go to our website, or if you sign up for the petition now, you'll automatically be entered. And we're grateful that you could take the time today to join us. We're looking forward already to the last installment, and just again, grateful to Ashley for taking the time.
Thank you all for all the hard work you're doing.
Thanks. Bye-bye.